Hello friends, how are you? Welcome to the fourth video in this series, that is birth control. We will discuss the miscellaneous topics in this video and it will complete the chapter of this birth control. So we will discuss first of all about the progestin only pill, that is also called as mini pill. So what does it contain? It contains norethindrone, usually in a dose of 0.35 milligram, and what has to be done? It has to be taken daily. There is no cyclical changes. There is nothing has to be explained to the woman that 21 days you have to take or 7 days you have to take a break. That is not of any problem here. It is given daily, but the woman has to be informed that she has to take this medicine at the same time. She has to maintain the time schedule for this medicine, because even if she delays her dose by 2 to 3 hours, it will affect the efficacy of the mini pill. And what is the failure rate? It is 2 to 7 per 100 women year. So it is relatively safe. Especially it is indicated in those women who are having contraindication for combined oral contraceptive pill. That means those who have the contraindication for the estrogenic part of the COCs. So which are those women? First of all, those who are lactating. It is a very good pill which can be given to the lactating mothers, because during lactation she will be having amenorrhea, and if we give this progesterone only pill, it will help her in getting this contraceptive benefit. Also, she will not have the side effect of this mini pill, that is breakthrough bleedings that occur because she is having amenorrhea, lactation amenorrhea. And later it can be extended. So one thing, it is good for breastfeeding women. Also it is ideal for women like those who have at around 40 years and those who smoke. They are the contraindication for combined oral contraceptive pills. And they are also for sickle cell anemic patient. This is indicated for in cases of mental retardation. Those women who have migraine or who has liver disorders and they want to take this contraception, but COCs are contraindicated. And those who have hypertension and systemic lupus erythematosus. So these are the contraindication for mini pill. And what are the mechanism of action? It can be asked in your Viva question very frequently. So it has got two mechanisms of action. Number one, it will make the cervical mucus thick and impermeable to the sperm transport. And the another mechanism is it makes the uterus, the continuous progesterone support makes the endometrial cavity out of phase to this implant that is required for implantation. So these are the mechanism of action. Now coming to emergency contraception. Emergency contraception. So, or it is also called as postcoital contraception. So this progesterone, high dose of progesterone can be given within 5 days of unprotected intercourse to avoid this pregnancy to happen. So this is called as use-piece method. This is use-piece method known as, and levonorgestrel is usually given in a high dose. Earlier it was 2-dose regime, but nowadays only single dose is also found equally effective. So single dose of 1500 microgram of levonorgestrel is given within 5 days of unprotected intercourse. Another thing that can be used as a postcoital contraception is intrauterine device. Yes, of course it can be put within 5 days of unprotected intercourse, so it will have advantage of giving postcoital contraception. Also it has advantage that this contraceptive effect will continue for the longer duration of time. So but it requires doctor's consultation and involvement of a medical practitioner inserting the intrauterine device. But it is better as compared to this pill, because it will have a prolonged contraceptive effect also. And the third one, which is US FDA approved, is 30 milligram single dose of ulipristal. It is the only indication nowadays for this ulipristal, although it is banned for the continuous use, but single dose 30 milligram is not banned for this mechanism of action. So what are the mechanism of action for this contraception? If you are using this levonorgestrel, it will impact the corpus luteum, and it will make the uterine endometrium out of phase. Also, it will prevent the implantation. So fertilization is not preventable, but implantation is prevented. It is a main aim for this emergency contraception. And also the same for IUCD, it will inhibit, it will interfere in the implantation. So these are the progesterone only pill. Now emergency contraception, and coming to long acting hormonal contraception, that is injectables. It is DMPA is available in a dose of 150 milligram intramuscular. It is injected and it gives protection for up to 90 days, and it has to be repeated. So mechanism of action is the same as the progesterone only pill, but it is a injection which is given over every 90 days, and mechanism of action is the same, and indications are also same as minipill, but it is given in an injectable form, and minipill is a daily oral form. So this was all about this birth control miscellaneous topics. Now I will be telling you one important question that is frequently asked in exam. Either it can be asked in your theoretical exam or in viva also. The question is, what is cafeteria approach in this contraception? So cafeteria approach, it is the plan of Indian government of India, that as if you go to a cafeteria, you have all the choices and you select what you want to take. Similarly, when a couple comes to a medical practitioner or a healthcare provider regarding this contraceptive advice, then the medical practitioner or the healthcare provider has to offer all the information about all the contraceptive methods that are available. Because this contraception, you cannot impose it. Contraception is a thing that has to be come from within the person who is using it. It requires many methods, they require motivation. Suppose someone doesn't have that much motivation, and you give them the daily OC pills, or suppose daily this progesterone only pill. Will she take? No, she will not take. She will take 2 to 3 days, then she will skip. So it will have more hazard. She will think that I am taking contraceptive, but she will end up in unwanted pregnancy. So cafeteria approach is very important. You have to offer, you have to tell all the benefits, all the drawbacks of all the method, and then the couple will decide what method they want to use. So this is a very important thing. You just can't say, okay, you take this, I advise you this, I advise you that. You have to only give the knowledge about what are the advantages, what are the disadvantages, who should not use it, who should use it, so that the couple can make the informed choice about this contraception, and they pick it up by their own which contraceptive method they want to use. So this is the cafeteria approach, and it is the it is not because of this medical terminology. It is important because it has got a role in the Government of India advisory. If you like this video, please subscribe to our channel for more videos.